Hey guys, we're going to give us just a couple of minutes to get started here. We appreciate everyone joining us tonight. I can see folks logging in now, so give us just a minute and we're going to go ahead and get started. Thank you. Yep, we've got some people joining, continuing to join. So we're going to just wait another minute or so, give people an opportunity to join. And for those who are just recently joining, we want to make sure and encourage that feel free to ask any questions throughout the webinar tonight. We want to make sure you get all your questions answered, so feel free. We've got the amazing Dr. Marshall on board with us today. We've got Kim Gonza. So you've got some really smart people who are super excited to talk to you about these GLP-1s, this incredible group of peptides and medications that are changing the world, obviously. And excitingly, Oprah came out just a couple months ago and talked about her journey with these incredible medications, compounded Tierzepatide, compounded Semaglutide, and we're going to talk a lot about that. So without further ado, let's go ahead and get started. My name is Tim Sawyer, and I work with Dr. Marshall at Tru Male Medical. And so my role tonight is just going to be a guide, make sure that we stay on track. We're going to spend about 30, 40 minutes together. I'll be the one to facilitate the answering of any questions that you have. Super excited, like I said, to have Dr. Marshall, who's the medical director of Tru Male Medical. He's been working with these medications for a long time. He's an expert in men's health. We have Kim Gonza, who is him and her weight loss and wellness co-founder, my business partner in that, as well as Dr. Marshall. And then Kim works with lots and lots of folks, not only in him and her wellness, but also in KG Aesthetics in Delavan, Wisconsin, which is a really cool med spa. And one of the things that she does at the med spa, and we're going to talk a little bit about tonight, is something called Ozempic face. So sometimes when you lose weight real fast, you might get a little saggy skin. And Kim actually has a really cool, and I want to make sure she reminds me, Kim has a really cool, simple solution to use in the med spa to make you not only feel great, lose weight, and then get that flex in that skin you need, right, Kim?
Right.
It's going to be amazing. So with that said, what we want to do, our agenda for tonight is the following. We're going to talk about the history and science behind GLP-1, introduction to compounded Tierzepatide and compounded Semaglutide. We're going to talk about the average weight loss for men and women. This is kind of a unique experience for me tonight, proud moment in that I personally have used these medications. We've got a little picture of some of the changes that I went through in this journey, but also some of the secondary and tertiary medical benefits that I was able to achieve under Dr. Marshall's guidance in this program. We're going to talk about how to get started, how you can save a couple dollars if you decide that you want to shoot us an email, give us a call, just mention the webinar. And then also Kim's going to talk a little bit about what Ozempic face is and the simple solution that she has to fix it. So if that sounds okay, and at the top of the screen, you can see how I managed to lose 39 pounds in 180 days and kept it off. I'm keeping it off. And as of 8/23, meaning 8/23/24, I've lost a total of 39 pounds. And that's not even the best part. Stick with us and I'm going to share what the best part is. And then as we walk through this, there are some medical terms for sure, guys. I am not a medical doctor. I've never played one on TV. And so Dr. Marshall is here with us tonight to speak in layman's terms about some of the clinical terminology and what it means to you and me as the average consumer. So if that's okay, Dr. Marshall, we're going to start there.
Okay.
So, you ready, Kim? We'll start there?
Yep. Sounds great.
All right, here we go. Boom. So first that's me, 240 pounds to my left, and today, 201 pounds. But after 18 weeks We're going to show you the exact weight loss journey that I've gone through. And like I said, the medical benefits, secondary and tertiary benefits that I received that are absolutely amazing. And so, Dr. Marshall, talk a little bit about what does incretin mimetics mean and the history of these drugs?
So these drugs are actually analogs or the same function as peptides that your body makes naturally. It's part of your digestive system and your metabolic system to allow you to process food efficiently and safely. Now, some people have less of these peptides than they need, and sometimes that results in weight gain. And so these peptides are in everyone's body. It's not like it's a new invention, but it's a way of making that same peptide effectively so that we can augment what's going on in your body. The first one is GLP-1, and that's a glucagon-like peptide. Now, glucagon is a hormone that the body makes. It's a cousin of insulin, and it does just the opposite of what insulin does. So glucagon will raise your blood sugar, and insulin will lower your blood sugar. And that's what we need to do is we need to be able to slow the body's movement of food from the stomach into the digestive tract. That's what that does. And so by doing that, by slowing the gastric emptying, the stomach emptying, you have a feeling of fullness, and you have a feeling of I'm done eating. You might put a pound of food on your plate and eat a third of it, and you're like, I'm done. And so you slowly learn to eat less food because you're satisfied with less food. And then the other peptide, which is not included in semaglutide, but it is in tirzepatide, is the GL1 type of peptide, GLP-1, and that's a glucagon-dependent insulinotoma polypeptide. Big fancy words, but basically it means that it's going to slow your absorption of these nutrients, and so it's going to allow you to process the food without absorbing as much as you would have otherwise.
Got it. And what do people mean when they say, well, one of the benefits is this helps manage my sugar levels. So whether you get spikes in sugar throughout the day,
Sure.
Talk about that at a
Sure. Well, these drugs were actually developed for that purpose. So people who have type 2 diabetes were the target of this medicine initially. And the reason they were the target is because they have problems with managing and regulating their absorption of sugar. You eat a meal, and you put it in your stomach, and it's released into the intestines, and then the sugars are absorbed, and there's a spike, a sugar spike, and that causes an insulin spike if you have effective insulin production, which results in weight gain, and so you're going to store all that food. So that's the Western diet. That's Western. We have food every 5 feet apart. You can't be anywhere where there's not food available in this country. So our bodies are not meant to be eating food around the clock. Our bodies are meant to take about a 12-hour period off where we're not eating. And if we do that, we give our digestive tract a chance to relax and reset, and we also give our body a chance to absorb an appropriate amount of food. So that's what it was designed for diabetics, and it's effective for diabetics. It lowers hemoglobin A1C, which is a measure of glucose levels over a 3-month period.
Got it. And makes sense. So here's the deal, right? Everybody knows, oh, it's magic, Ozempic. And the reason I say kinda is I know we work with a lot of folks who have done really well with these medications, including myself. I'm the first guy to stand up and say, hey, this worked for me. And my wife, by the way, who's behind me and hopefully can't hear me saying this, after she hit 54 years old, went from 135, 140 to 172. and she is now at 55, weighs 129 pounds as of this morning, and just absolutely looks and feels amazing. So next time we'll make sure we get her before and after as well. So it is kind of magic, right? So talk a little bit about, Dr. Marshall, the history of these medications and how we got to where we are now. And
Well,
what's
so
MOA?
they can't start out as patented medicines. So a drug company developed this product, and they tested it, and they found that it was effective for what their target was, which was, diabetes. And they started to market it as a way to control people who have a hard time controlling their diabetes. And it was effective doing that. And so they started selling it, and they realized that it was a huge weight loss medicine. It wasn't their plan. It just turned out that way. And as a result of that, they started selling this medicine at such a rate that they couldn't produce it that fast. And it's going to take years for them to ramp up production to be able to produce this. That's how big a job it is. And so as a result, the FDA says, well, if the patent holder cannot produce enough of the medicine, and we see an urgent need for this medicine, then compounding pharmacies can produce this medicine. And so that's what's going on right now.
Got it. And what about people who say, well, it's not Ozempic. How can it be safe? How can semaglutide, the active ingredient, be safe?
Well, so semaglutide is safe, and it's actually a mimetic of what your body makes already, the GLP-1. So your body makes that, but for some people, they don't make enough of it, or they don't make it effectively when they need it. And as a result, they gain weight, and they have poor sugar control. So this medicine is a godsend for those people. And it's also a godsend for people who would like to lose about 20 pounds or 30 pounds.
Right. And what about the idea that these are somehow new? It's a fad.
No, it's not. No, this has been a target for a long time. They just finally were successful in coming up with a product that was administratable, safe, and effective. Those are both, strong caveats with the Food and Drug Administration. The drug has to be safe and effective. And so they have to go through years of developing this to prove that it's safe and effective. And they've done that. Got
it. And so Wegovy, that's the one of the trade names for semaglutide. There's research right here. So explain this research to us.
Okay. So let's say, you have this goes for any drug. So let's say you have a drug that you'd like to introduce. First, you have to develop it. You do an animal model. You do a organic chemistry model. You do a slow ramp up before you start human trials. When you're approved for human trials, then you start doing double-blind studies to see what effect you have. And so what's happened is these studies were so effective that they accelerated the introduction of these medicines, and the serendipitous effect was that diabetics who are type 2 started losing weight.
Bottom line. And the fact, so when it says FDA approved for obesity in 2021, to your point, we were using it, started with treating type 2 diabetes, managed sugar levels. Then they discovered the fact that this is literally a miracle drug for weight loss. And now we're getting through the process of normal folks like myself using it for that purpose in conjunction with some other things. And as we can see here, and we'll go through in more detail, average weight loss 15.1% of body weight, 35 pounds over 68 weeks. 83% of adults taking Wegovy, this is according to Wegovy, taking Wegovy lost 5% compared to 31% taking placebo. 30% of people taking Wegovy lost 20% compared to 2% of people taking placebo. And the study extended a year. Participants regained 2/3 of their weight without meds or diet or exercise. And that's one of the things we want to talk about, right? We're going to get into more and this is probably a good place to address that. So what about folks who say, well, yeah, I think I could lose the weight. I could modify some things. I could take a walk. I'll use the medications and then I'll lose my 20, 30 pounds, but I'm nervous. What happens when I come off? What do we have in place? And Kim, what are some of the things that you've thought through for the folks at Him and Her Wellness on how you're going to help them manage that transition?
Well, there's lots of options that we're using to transition off of the medication. Some people will slow down the process of how much of a dose that they're taking. They'll kind of ease back in. We can take a month off if we need to, 2 months off, 3 months off. They can go back on if they feel like they're getting some weight gain to kind of maintain if they need to. Other things that we do leading into this is we do a lot of diet discussion, increasing their proteins, kind of talking through the diet part so that when you come off, you're not feeling hunger because you're eating processed food or lots of carbohydrates that don't fill you up and don't have a lot of nutritional value. And then another thing that we're considering transitioning, and this is just kind of in the works, is doing some NAD shots, and there's more to come on that, which increases your metabolism and your energy and things like that.
Right.
So
Got
that's
it.
what
And,
we're doing.
and Dr. Marshall, so this
Yes.
idea that people get concerned, I hear this a lot in the folks we interact with at Tru Male, is they say, well, I feel like I'm losing weight, but they're worried about losing muscle mass given their
Yep.
age. Is that true? And if that is, if there's the possibility of that, what can someone do to avoid losing weight they don't want versus muscle?
Well, to start with, what you're really trying to lose is fat. You don't want to lose muscle. But anytime you lose weight, depending upon your metabolic, where you're at, where your metabolic system is, if you're aerobic, anaerobic, etc., you're going to burn both fat and muscle. Muscle's easier to burn than fat is. You have to be able to oxygenate the fat to digest it. And so, unfortunately, if you're not getting the proper amount of protein and exercise, you're going to lose 20 to 30% of your loss is going to be muscle. And that is, I've seen, I saw a patient today who basically lost 70 pounds, but she lost about 30 pounds of muscle, and she's a hard time walking right now. Now she's a successful weight loss person, but she needs to get involved in, weights and bands and protein intake, plenty of sleep, and proper diet. And she's going to be able to regain that muscle mass, and that metabolic machine is going to ensure that she doesn't regain the weight. So if you have a low amount of muscle, you tend to do less exercise. You have less muscle to do with, and as a result, you're going to not have the ability to burn the calories that you consume. So we need to get these people in a position where they can maintain their weight loss while maintaining their muscle mass.
Got it. And protein, you mentioned protein intake is important, right?
Yes,
And
yes,
and
absolutely.
doing some weight work is also important, right?
Absolutely.
So
As a result, most people don't get the proper nutrition. I mean, there's a lot of micro and macro nutrients that people need that they're not getting. And so we work with our patients and discuss those things with them. We do laboratory tests occasionally, and we do in-body measurements to look at their percent body fat, percent smooth muscle mass, their total body water. And that's what we watch more closely than BMI. Schwarzenegger had a BMI of almost 50, but he wasn't fat. So, I mean, BMI is a good, average thing, but I don't think that people would say that Arnold was a fat guy.
no, I don't think they would. So, and now we're pivoting, right? So we were talking about semaglutide and then tirzepatide. What's the difference, the primary difference, other than we'll show some average weight losses are higher with tirzepatide, but why is that?
Well, it has two ingredients as opposed to semaglutide, which has just got the one major active ingredient. The GLP-1 is active in both of them. So, and that's the one that's going to slow the gastric emptying. It's going to slow the motility, and it's going to allow for, weight loss. But there are some serious side effects, GI wise, with that medicine if you take more than your body is willing to accept. So
Right.
that's a rate limiting step. You can keep increasing the dose, which we will do, but if you can't tolerate it, or if it's causing too many side effects for you, then we need to find a different way. The tirzepatide adds a GIP, which is a type of it's similar to allowing you to not process it as quickly as you would otherwise. So it goes slower through the digestive tract, and as a result, there's less absorption over time, and as a result, you gain less, you lose weight as opposed to gain weight.
Got it. And less side effects, right? With tirzepatide.
And because the dose that you usually end up going with, and you shouldn't compare apples with oranges, because when they say it's so many milligrams, whatever, there's 2 active ingredients in one and 1 active ingredient in the other. So the tirzepatide, even though the milligrams may be high, the GLP-1 is not as high as it would be if it was semaglutide. So people lose more weight, and there are less side effects with the tirzepatide.
Got it. So for my friends, they tell me, Tim, what's the difference between tirzepatide and semaglutide? And I say, well, are you a drinker? And they say, yes. And I said, well, tirzepatide's like Belvedere and semaglutide's like Tito's. I don't know if that's appropriate for a wellness conversation, but
one of the nice things about tirzepatide is that for those people that feel those hunger pains, often it's really hard for them to turn off. Tirzepatide is one of those medications that will help turn off that receptor that they're feeling hungry all the time. So that might be a good medication to start with. We like to use that first because there's less side effects with it. I feel like people, you can get some nausea with semaglutide. So tirzepatide, we kind of are starting patients on that and seeing how they do, because the side effects are less. It turns off that hunger receptor, and they can do better with this.
got it.
Sometimes.
Makes sense. All right.
Yep.
So Kim, talk about this a little bit when it talks about the difference in dosing and what the dosing means and your protocol, which is the same as Tru Male Medical, and how you go about that.
So, like I just mentioned, we are trying to get patients to start on tirzepatide. It is, however, a little bit more expensive, but it can be more effective than semaglutide with less side effects. Dosing starts at 2.5 milligrams for tirzepatide and 0.25 for semaglutide. And then we see how the patient does. We get them started on that dose. We reevaluate them in a month and see if they've lost weight, if they feel less hungry, how their side effects are. And if they're doing well on that dose, we'll keep them at that dose. And if they haven't lost weight, or they're feeling like, they're still very hungry, then we'll up the dose. We also will go through what they're eating to make sure that they're eating the right foods, that it's also keeping them full. We have to be careful people don't lose, get a low blood sugar and things like that, not eating all day. So you want to make sure you're not overdosing people. We generally start low. Everybody starts at a low dose, so we just keep monitoring as we raise that dose up.
Got it. And in terms of your intake protocol, when you're getting ready to decide what doses to start, which medications to start, I assume there's some type of weight tracking methodology, right? How are you doing that?
So patients will come in to see, they'll see the nurse practitioner at him and her, and she will do a body scan on them. We'll get to know how much fat they have, how much, well, obviously what their weight is, how much fat there is, what their BMI is, how much muscle mass they have. And then that's the starting point. We go through a thorough history with them, making sure that they qualify to take the medications. We want to make sure what is their goal weight, what are they looking to get to, and then how we can work together to kind of get them to that point. We do blood work as well. We want to make sure that their labs are looking good, that they're not low in B12, or sometimes people can even be low in vitamin D. If we think they're low, they could be low in that. We'll check that level as well. We're checking thyroid levels, and just making sure everything looks like they're well. If they are, then we can put them on these medications. Like I said, typically it's tirzepatide to start with,
Yep.
semaglutide if we want to.
And so it sounds to me, and so people understand, the weight loss programs that you guys, these are medically based weight loss programs. It's not just the person comes in, you stick a syringe in them, you say, okay, you'll be fine. There's more
No.
to it than that, right?
Yeah, so we there's a lot more to it. We want to find out their eating habits. We do have them download an app as well that's they can log their food in. So then when we see them back at a month, we can kind of evaluate, what is going on? Are they eating correctly? How much protein again are they taking? How much exercise are they getting in a week? We give them suggestions on what they should be doing. Most people, when they're investing in their health and they're paying money to try and lose weight, most of the time they will invest in the other side of it, as well as trying to work on their food intake, trying to lift weights or do some bands or something like that to keep the muscle mass up,
Yeah.
nice and at a good level. So we're working with them with that. We're keeping monitoring. We're going to check them in a month. So 4 weeks, you're going to do your follow-up visit. At that time, we're going to do scans again, see where we're at with your BMI, your weight, your side effects, and that dosing. There can be other factors as well. It can be stress. We'll kind of help guide people through, if you're not losing weight, maybe there should be some other techniques of stress reduction, etc.
Right.
So
So
I want to agree with what Kim said, and I want to just expand just a little bit in that in order to gain muscle or to lose weight, you have to have three things. You have to have a good diet, you have to have proper exercise, and you got to get enough sleep. You need to rest. Your body needs to equilibrate and reset. And by doing those three things, you'll have results. And of course, tirzepatide will improve those results.
right. And so on a personal note, for me, it was like, the most I ever weighed was 265. I weigh under 200 pounds right now. And as someone who played soccer in college, things got away from me, right? And so I was lethargic and didn't feel like I wanted to go and lift weights or even go for a walk. And taking tirzepatide, it gives you that boost, right? And so if you're looking at, you're trying everything and can't lose weight, take tirzepatide or semaglutide, and you say, hey, wait, I lost 3 pounds last week. And it kind of gives you that hop in
Yeah.
your step, right? And a little bit of energy, and you're starting to feel like, hey, I'm not 100% focused on food all the time. And then you kind of transition. And it sounds like you guys are helping them in that transition with guidance around, like you said, what you're eating, simple ways to work out. Doesn't mean you have to become Arnold Schwarzenegger, but certainly, when people ask me, I say, yeah, go for a walk. Go on a treadmill for a half an hour. You'll be fine. And so I think it's good for folks to know that you're taking a holistic approach to that. And so talk a little bit about this, guys. So BMI 27 plus. First of all, what the hell does that mean? What the heck does that mean? And obesity-related conditions such as sleep apnea, diabetes, hypertension, high cholesterol. So folks who think that just being overweight just means you don't look good, what are some of the real consequences, Dr. Marshall, as we age with obesity?
Okay, so we call it the metabolic syndrome. It's an amalgam of various results of being obese. The first one, of course, is that you can develop diabetes. That is, kind of goes along with being obese. That your body cannot produce enough insulin because you're consuming so many sugars and other calories that basically, you're slowly processing the food. Secondly, you become insulin resistant, so that your body just doesn't respond to the insulin, and as a result, because you're making your cells absorb so much nutrients that they're exhausted. They're basically just worn out. So the insulin is and your blood sugar goes up. And then there's the cholesterol part of that. The cholesterol is necessary for life, but too much cholesterol and the wrong kind of cholesterol can cause problems, including cardiovascular disease, all kinds of vascular disease, and strokes. We all heard about cholesterol, and the metabolic syndrome's involved in that as well. And then the the last one is that because of the obesity, you become more sedentary, and your activity level goes down and your muscle mass goes down. So it's like a perfect storm that causes, and we see a lot of Americans with this, with the big pot bellies, and unfortunately, and with basically they look like they're 10 years older, 12, 20 years older than they actually are. And that's unfortunate. It's not necessary. And, part of it is just because we haven't, called enough attention to it, but also part of it is just because of our lifestyle.
Right.
Choices we make.
Right. And I love the way you phrase it, Dr. Marshall, when you say, nature has little use for men after baby making age. And, nature's plan is to just let things start breaking down. But you have the Dr. Marshall plan, which is different
that's
from nature's plan.
You just throw the finger at Mother Nature and say, I got my own plan, and here's how it's going to be. And Mother Nature might have a plan, but you are the person who can make a plan happen. So you take charge. You don't accept what some people think of as inevitable aging, and you basically decide your own future, and you decide how you're going to accomplish that, and you do it with knowledge, knowing that proper nutrition is important. What is proper nutrition? And lifestyle changes are important. And what is proper lifestyle changes? So, and getting enough sleep, and making sure that your sleep is good quality. All those things are going to put years in your life and life in your years. And that's what you want.
And your book's coming out pretty soon. People will be able to read that and get back in the game.
That's right. Fourth quarter, it's winning time.
Can't fourth quarter winning time.
Thank you.
I love that.
Thank you.
So the other piece, and then we'll get to how folks can get on board with this, is how are we able to do this?
Tim, can I just mention something really quick too?
Sure.
I think it's really interesting. If we go back just to that last slide, the recent American Heart Association recently released in their 2023 session that major cardiovascular disease events risk is cut by 20% in adults without diabetes and with overweight or obesity by taking semaglutide. So this is like a new thing. The American Heart Association is coming out with these studies that they've been doing and showing that how much of a risk factor is decreased when you're obese to your heart disease. So it's really an up and coming thing to mention, that the American Heart Association is acknowledging how important these medications in obesity is.
Yeah, it's huge. And it's going to be getting smaller. So I'm excited, and I'm walking proof of what's possible, right? And so we talked a little bit about this. Dr. Marshall addressed it, how we're able to offer these medications. The reality is that there is a shortage in the country, guys. And when there is a shortage, we are able to go to well-run, super clean environments. They're called compounding pharmacies. It's the same ingredients that you would find in these brand name medications, same efficacy, and that's where we're at. So that's why you see guys all over the internet, buy your semaglutide here, buy your Tierzepatide there. The one thing you want to be careful about, as you can tell, is you want to make sure that there are medical folks administering these programs, and those medical folks are vetting these pharmacies, that you're not, a lot of these medications can come from, no offense to people from China, but you get medication from China, you get it from Mexico. They're not the same medications. They're really not. And so if you see someone that says, hey, I can get you on semaglutide, it's $20 a week, you can't do that, right? That person would be subsidizing their lifestyle by providing medications at a loss, and no one's going to do that. So I think that's
they have no plan on how you're going to get off of those medications either. We do see patients that come in, they've gone through an online place, they have no plans on how they are going to wean off, or if that medication comes to a plateau for them and they can't get that last 10 or 15 pounds off. There's nobody working with them to help make that a complete plan.
Yeah, and I think that's really important, and we've covered that. And I want to also make sure that if anybody, there's a lot of folks on the webinar, if anybody has a question, make sure that you put it in the Q&A or put it in the chat. We'll make sure that we get to them, and we're got a few minutes left. So, and obviously, guys, we want to be with an abundance of caution. Always let people know that there are some risks, although minimal, and I don't think we see a lot of it at Tru Male, but there certainly are risks. So you want to make sure that you work with a medical professional who knows how to minimize those risks with the proper dosing, encouraging you for the proper diet, encouraging you in your workout strategy. Both Kim and Dr. Marshall are experts at that, so that you can minimize some of these things. And then before we jump into the last piece and start to wind down, Kim, I wish I had put a slide in here. I didn't, but it is a real thing. And for those of you who can see this, I've got my little turkey neck here. So while I don't have Ozempic face per se, I'm on my way. So
Got
if they're
Ozempic
getting
neck.
Ozempic. So what is Ozempic face, Kim, and how are you going to help them get rid of it?
So Ozempic face is just termed what you look like after you've lost weight. I mean, anybody who loses weight, exceptional, 20 pounds, is going to look different in their face. If you look at an obese person, their face is really round and filled out with a lot of fat in their face, which as when we're young looks great, right? That's what makes you look young. But when we start losing that fat, which is fabulous for your health and the rest of your body, you can start feeling like things are sagging and dragging down and falling down. So we have lots of different things that we can use to help, fill in lines, but we use one of my favorite products to use for Ozempic face is a product called Sculptra. And you inject Sculptra into these areas where you've lost fat. And the beautiful things is you're creating collagen in those areas. It's not hyaluronic acid or anything like that. It's collagen that you're going to start producing in those areas to kind of bring back and lift up some of those, that part that's fallen, and you're going to feel filled in again. Is it looking too full? No, we just kind of work, and it takes some time. Over a year, we're putting in very slowly and watching things grow in, so it's a very natural look. But if you're scared of that and you've heard Ozempic face, just know anytime you lose weight, you're going to sag in your face. It's not really a thing that these drugs cause this Ozempic face. It's really, you just lose weight. And if you lost weight by, doing some fad diet, you would have Ozempic face too.
Right.
So, and it's a real thing, because I do get this little thing jiggling here, and I'm trying to figure out, someone's got to help me out. And
Come on
I'm
over.
not ready to go like this, but I just do this and it's funny and people love it. So
Part of the thing that motivates people to do anything is their ego.
yeah.
And the ego is a healthy thing. And if you have a healthy ego, you want to look good. And if you have a healthy ego, you want to be good and you want to feel good. So, part of that is the cosmetic side of it. There's nothing wrong and nothing untoward about wanting to look good. You want to look healthy and you want to be healthy. But, part of it, you feel better. People look at you and go, wow, you look good.
Right.
And that's part of the reward of taking Ozempic.
Yeah. And we're in a position, fortunately, given the backgrounds of Dr. Marshall and Kim, that they are both experts in the medical side of it, as well as the aesthetic side. Because we get that there's the duality, right? They go hand in hand.
Yep.
And we encourage that. So one of the things that we did want to say, guys, for anybody who's watching the webinar, and again, I'm paying attention to questions. If anybody has a question, please ask it. Hopefully we've answered most. To get on Tierzepatide, as Kim and Dr. Marshall mentioned, less side effects. It's a 6-month protocol, $4.99 a month, webinar attendees. There is a discount. You save $100 out of the gate. And we certainly encourage you, just if there's the websites are on at the end of this, how you can get on it, where you can go. Kim's certainly available to talk to you. Dr. Marshall does consults with this all the time. And again, we want to be competitively priced, but we also want to make sure that you're safe and you're reaping all the benefits associated with weight loss, which includes feeling healthy as well. Someone just typed in, are there any long-term side effects to these medications? Who wants to take that? Dr. Marshall, any long-term side effects?
No, the side effects would come from abusing the medication. But if you use the medication properly, the long-term effect is that if you've maintained your muscle mass and you've lost some fat mass and you took care of the cosmetic side of things and you've changed your lifestyle so that you can maintain those, you're going to be fine. Some people will take a weight loss medication like this for 6 months and then they'll get off of it and they'll go back to their old ways. Oprah's very famous for doing that. She'll lose 80 pounds and then she'll gain 80 pounds. And that's the yo-yo diet, the yo-yo approach to weight loss. It needs to be a lifestyle change. Once you do our program, we want you to change your lifestyle so that you are successful going forward. So that the long-term side effects would not be present at all.
And that's the benefit of going through a program like this and not doing any online, just take it and have no foundation of changing your lifestyle. So that's the perk of coming through, seeing us monthly, getting weight checks, being encouraged, being taught what you should be eating. We'll follow your food, what you've been putting in, and then also give you some suggestions on how you can improve things.
Yep. We're invested in your success, and what we enjoy is you being successful. And so, we know it's going to be work for you, and it's going to take some concentration and some dedication. But you know what? It's worth it. So we want to encourage you and coach you along the way so that you are successful.
Got it. And then there's another question that just came through that says, how do you take the medication? Kim?
Kim, do you want to explain that to?
Sure.
Okay, go ahead, Kim.
So at Him and Her, we do draw the medication up for you. So this makes it one less step that you have to worry about pulling the medication out of a vial. So we pre-draw everything for you. So the dose is ready to be given. You'll be able to give that dose to yourself. We're going to teach you how to do that. And if you don't feel comfortable taking that medication on your own, that medicine is not a pill, it is a shot. And it's a very, very teeny tiny needle. Most people do not even feel the needle go in. It's very painless. And we will teach you how to give it to yourself. It's very easy. If you feel nervous to do that, you can certainly keep coming back and we'll give you that shot weekly if you want. So it's one shot every week. I mean, I don't even want to call it a shot because that word sounds painful because it's not painful.
No, I've done it. Yeah.
It's teeny tiny. And we teach you how to do that, but we want to make sure that you're confident in doing that with lots of education in office. And then we send you home with it. So you can spread your wings and be home and do it yourself. And it's not very hard at all.
Easy peasy.
Yep.
An average weight loss after 1 month, guys, average weight loss is 7.4 pounds on lowest dose of semaglutide. Maximum 1 month weight loss, I've never seen that, but these are the studies, 22 pounds. Reduction in food noise after first dose. So that craving that you have, and I can speak to myself and I will here, the craving that you have to eat and also what you eat. We have a tendency to, if we've not been eating healthy for a long time, our go-to food is not the best thing for us. It's not pizza, it's not Wendy's. But if we're accustomed to that, that's what we're going to crave. And it starts to drown out that noise and will help you get going. After 2 months, 11.6 pounds. These are averages, guys, across millions of people. After 3 months, 18 pounds. After 4 months, 26 pounds. So these are, it's serious stuff. And I like I said, I can speak to it myself. I was 240 pounds. I weigh 200 pounds now. But the part that I really wanted to emphasize before we wind down is what are the other benefits that I received from going through this protocol under Dr. Marshall. Okay, so I went into Oak Brook, into the office in May 8th of 2023, and I went on what Dr. Marshall was talking about, the in-body scan. And I'm going to have Dr. Marshall kind of break down in a minute what this means. Total body water, 124.8, dry lean mass, 45, Body fat, 70.3. I weighed 240 pounds. Total body weight, last time I went in, and that was in May, I'm doing better, even much better now. Total body water, 117, dry lean mass, 42.8, body fat mass, down from 70 to 48.1, and my weight was down from 240 to 208.6, which I'm now 201 pounds as of today. So what does that mean when it talks about body water and dry lean mass, Dr. Marshall?
Okay, so basically, the machine that we use is called an in-body, and it sends electrical current through your body between your hands and your feet. And fat is a resistor to electric current, and muscle and water is a conductor of electric current. So it sends different wavelengths of electricity, and the impedance is measured, and as a result, we can measure the percent body fat in each one of your 5 compartments: your left and right leg, your left and right arm, and your trunk. And we can measure the same thing, smooth muscle mass, and we measure the same thing, percent body water. Why is that important? Well, we know that if your percent body fat for a male is 15%, you have the best chance of living a long, healthy life. 15% is the sweet spot for men. Less than 15%, you're too thin. More than 15%, you're too fat. And so if you can get in, now everyone's not going to hit 15%, but the closer you get to 15%, we know that there's a curve of distribution of lifespans, and the people that males at 15% live the longest. Now, you might get struck by lightning tomorrow. It's unfortunate for you, but as a population, the whole group is going to average a longer lifespan, right? So, and same thing for women. Women is like 21 to 22% is the sweet spot for them. They have more subcutaneous fat, and that's part what makes them so delightful. But you know, that is a healthy. That's healthy for them. Guys, you need to be a little thinner. So if we do that, if we get that percent body fat down, the only way we're going to do that is to stop putting so much food in our gut, and also to improve, you know, the amount of smooth muscle mass we have, and that's going to make it so much easier. Once you've improved your smooth muscle mass, you are a metabolic machine. You just need to do a little bit of working out, and you're going to, you know, you're going to be able to process food, and you're going to be able to maintain the weight that you're at. You're going to look great, and you're going to feel great.
So this is kind of my summary here, guys, of what I went through. So my blood pressure, Dr. Marshall, who helps me with a lot of the stuff, knows prior to being involved with Tru Male Medical and him and her, I ran a digital marketing software company, and I traveled 42 weekends a year, and I had a crazy schedule and eating and drinking all the wrong things and living on the road. My blood pressure, my normal blood pressure, guys, was 150 over 110 all the time at 265 pounds. So in my early 50s, literally a walking time bomb. When I created this PowerPoint, I just did, it was 125 over 76. I went in to get an IV drip last weekend, and it was like 119 over 72, less than my 27-year-old daughter-in-law who was getting an IV with me. Embarrassing. I killed her. So my blood pressure is actually, and she's an ICU nurse, so she understands. And I was able to get off amlodipine, which is not a great medication. I was able to get off Aprezo because, unlike some of the side effects, I've had ulcerative colitis my whole life. It actually resolved a lot of that, and I got off my Aprezo. So I had dramatic improvement in my GI system functionality, a lot less pooping, obviously, more energy, increased libido, better sleep per my wife, a lot less snoring, which is really cool. I started working out 4 times a week, and I've stuck to that. And in order to avoid muscle, it's important to eat healthy amounts of protein. And I do some mild weightlifting. Dr. Marshall showed me some exercises that I could do. And so I've stuck to that regimen. So I went from a 265-pound sedentary human with no motivation to a 200-pound human who I still have to make it a point. I get caught up in my work, and if I forget, you know, then my default isn't to go work out. It never was, right? So I just have to make it a point that even if it's just 20 minutes on a treadmill or just to walk around the neighborhood, just get out and get active and do something that changes the way you're thinking about your health. And just like we make work a priority for some people, or whatever we're idols that we have that we worship, we got to worship ourselves first, right? And particularly as we age, that needs to become a priority.
Right.
And so that's kind of my plea to you. The reality is, and I apologize, I didn't grab KG, it's kgaesthetics.com, kgaestheticswi.com for Kim's med spa. You got to check it out. It's awesome. It's in Delavan.
It is.
himandherwellness.com. You can visit us there. Tru Male Medical, give us a ring. We're in Delavan, right next to Kim. We're also in Oak Brook. We would love to have you come visit us. Consultations, Dr. Marshall is wonderful to talk to. The only problem is people want to stay all day, and we're running a practice, so we can't do that, but we'll give you plenty of time. So we encourage you to reach out. Like I said, you could save some money. Just mention that you were on the webinar. We'd love to get you started. It's a super easy process. The intake is it's a relief. It's not a problem. It's a relief. And once you get in the care of either Kim or Dr. Marshall, you'll feel relief. And more importantly, what my patients tell me all the time, we survey all our patients after every appointment, is they say, I felt like after going, I felt like I knew I could do it. And it's then there's this motivation that kicks in. And of course, when you have relief combined with motivation, that everything is going to be amazing. So we appreciate all your questions tonight. Hopefully we got them all answered. I think we did. We encourage you to visit Tru Male Medical. We encourage you to visit him and her or KG Aesthetics. Reach out, give us a call. Dr. Marshall, Kim, just want to say how much I appreciate you guys taking the time tonight.
Thank you, Tim.
As medical professionals, hope everyone got the information they need and found some relief in the fact that they know that there are places where they can go and get help to lose weight, feel great, and keep that weight off. Most importantly, I think, is the message. So with that said, once again, thank you guys. Thank you everyone for joining us tonight. Shoot us an email, visit the site, give us a call. We'd love to hear from you. Have a good night.
Thanks,
Good night.
Tim. Good night.
Thanks.